Thank you. Good afternoon. Oh, wow. That was really, you guys are a rough crowd, I can tell. Good afternoon. All right, much better, much better. Again, I'm Beth Skinner. I'm with the Council of State Governments Justice Center. We lost the PowerPoint here. Oh, there we go. It's great to be here in Salt Lake City. This is actually my first time in Salt Lake City. So I've been here less than 24 hours, and I've already had two interesting experiences since I've been here. First being the red iguana, which is like the single best Mexican food I've ever had in my life. So Yelp totally did not do me wrong on that. And second is I was a part of public safety this morning when I was sitting on my balcony at the Sheraton overlooking the mountains in the morning having coffee, and I hear these screaming, and I see two suspects are running different directions, and the city police, Salt Lake City Police Department, their officers were chasing them, and I was able to say, because I had such a good view of the buildings, I'm like, between that building. And so I was able to help them out. So I feel like I've come and served duty while I was here. So I felt pretty good about that. So who thought I'd be enjoying the mountains? And the next thing you know, I'd be saying, hey, that guy ran between the Comfort Inn and the gas station. So there you have it. Justice served. So today, really, I'm going to talk about reentry, and I'm going to really focus in on information sharing today. I'm going to talk about some of the priorities and practices. But first, before I start talking about information sharing, I want to give you a little background about the Justice Center and what we do. We're basically a national nonprofit, nonpartisan membership association of state government officials. We engage members of all three branches of government, and we provide practical, nonpartisan advice informed by the best available evidence. These are the different areas we work in: corrections, courts, justice reinvestment, law enforcement, mental health, reentry, substance abuse, and youth. What I had the National Reentry Resource Center. And this is a project of the Council of State Governments Justice Center. It's funded through the Bureau of Justice Assistance, which is funded by Second Chance Act funds, which Gordon mentioned earlier. We actually work as part of the responsibilities of the National Reentry Resource Center. We work with over 600 grantees to date, provide them technical assistance in 40 different states. And what we do is we provide them individualized, intensive, and targeted technical assistance. We provide them distance learning and support to the Second Chance Act grantees. And they're all over the country. Also down below, you see our website link. We currently have about 1,500 different, we have a compendium of different publications on just reentry alone. What Gordon was mentioning about the recidivist reduction study earlier on in his presentation is also there on the website. We also have a monthly newsletter. You can sign up for it up here on the link, and I can get that information to you all if you're interested. And what we have in our monthly newsletter, we talk about the latest in reentry practices, training, and funding opportunities. So feel free to check that out and sign up if you're not already signed up. Okay, so I put my plug in and I'm done. All right, so let's talk about the presentation today. So what we're going to talk about today is why prioritize recidivism reduction, right? So what I'm going to do is really set the context for why this work is so absolutely important. And then I'm going to talk just briefly, why does reentry matter? And then I'm going to talk about why information sharing is important. And the last piece I'm going to talk about is case studies around information sharing. I have 4 case studies, so hopefully in the amount of time I have, I'm able to go through most of them. But I just want to give you some examples of what people are doing out in the field in terms of innovative practices around information sharing. So first, setting the context. I'm sure most of you have seen this data before. We know that we have an ever-expanding corrections population. We have 7 million and counting. We know that this number has tripled in the last 25 years. We know that 4.2 million are under probation. We know that 824,000 are in parole. We know that 1.5 million are either in state prisons or federal prisons. And we know that we have 780,000 people in jail. So it really talks about why our work is so important, because we have such a huge population we have to address. Also, why is our criminal justice work important? Well, we know that 1 in 33 American adults are under some type of correctional supervision. Okay, and you see the numbers there. We know that 97% of the individuals from jail and prison are going to return back to your communities. That's a lot of people. I see a lot of heads nodding. We know that recently BJS had a research study that came out just in the last year that found that 68% of state prisoners are rearrested within 3 years. We also know when you get to 5 years, 3/4, it goes up to almost 75%. And we also know that 50% of state prisoners are reincarcerated. So should we prioritize recidivism? I think so. The numbers really tell the story. Some other facts in terms of resources about state corrections in the United States. We know that $52 billion is spent annually. We know that 1 in 14 state general fund dollars are spent on corrections. We know that 1 in 9 corrections dollars is spent on community supervision. So knowing this, the data I've just shared is that, policymakers want to have a response to this, right? This is an issue that needs to be addressed, right? We know we have many, many people involved in the system, and especially we have a lot of people that are coming back into the system and continue to recycle into the system, which causes a lot of strain on the resources. So response from policymakers are to generate cost savings, right? And to enhance public safety through recidivism reduction. And others is to create new policy and legislation and asking corrections agencies to adopt different practices. And a lot of things with the ARC, which is great, and I read about the great things you're doing, is implementing evidence-based practices, right? Is using risk and needs assessments to drive case management and case management decisions. Excuse me, I'm just getting over a cold. To shift to a rehabilitative model versus more a punitive model. And then actually using programs that actually address criminogenic risk and needs, and I think Deborah's going to talk about that a little bit later. And then use supervision techniques that facilitate successful reentry and reduce technical violations. So we have a lot of work to do. So next I want to talk about, now that we talked about the data and kind of set the context for our work, let's talk about why reentry really matters. Well, it matters for a lot of reasons, but I named these 4 reasons up here. 1 is to help reduce recidivism, have less victims, and to stop people from continuing to cycle through the system. Because we know, as the statistics are telling us, 50% are going back into prison, 75% after 5 years are being rearrested. There's a strain on our resources. Stronger families promotes family reunification and pro-social relationships, whether it be reuniting families, children, work, housing, things like that. Improve community well-being. Improves yields economic outcomes to healthier communities, gets them back into the job market, ties into more pro-social others. And smart use of taxpayer dollars. If we reduce costly reincarceration, some of that money can go towards other services that we may want to focus on, like education, for example. Also, what we know about reentry is it's a vulnerable time for individuals that are returning to their community. I'm sure a lot of you probably know that, but I think there's some interesting tidbits of information here, is that people that are returning are have elevated health risk following release. They have a higher risk of drug usage. They have a 12-fold increased risk of death in the first 2 weeks after release. Did you guys know that? Is that the first time you guys seen that statistic? Yeah, it's pretty compelling. But we know that if we have effective transition planning and implementation, we can minimize the risk of these hazards. That we can enhance public safety by increasing the possibility that individuals will participate, complete supervision and treatment requirements, and promote recovery and improve individual outcomes. So, talking more broadly about reentry, what are some of the main things we should be focused on when we're talking about reentry? Excuse me. One is the application of risk, needs, responsivity principles. I'm sure most of you have heard that before. R&R. Mentioned that earlier on the first presentation is the R&R model by Andrews and Bonta, who developed it in 1990. Very well-researched model. And I think Debbie's going to spend some time talking about the R&R model. You can drink water. Excuse me. Other activities, evidence-based practices. Again, one of your mission statement of ARC is using evidence-based practices. The process in reentry should be seamless. And what do I mean by seamless? Seamless meaning that when people are leaving an institution or jail, that they have parallel services when they're being released, or they have their next appointment set for a mental health provider, or their next appointment set for their substance abuse provider, or they have their parole agent appointment set up. Things like this that we can plan for. Planning in advance, not waiting for the day that they're released to send them out and give them a check and tell them get them on their way. Planning 60, 90, 120 days in advance when people are getting ready to be released. Collaborative. What we've learned over the years and years is that we cannot operate in a vacuum. We cannot provide all the services that the offender needs or the justice-involved individual. We have to rely on our partners to provide those services. Corrections, the jail, probation cannot provide all the mental health, substance abuse, cognitive behavioral, all these different services. We have to rely on partnerships because we cannot provide them all. So we have to have good collaboration. We have to have all these practices that we're doing around reentry have to be reinforced by policies, right? And what I've known from working in corrections for 10 plus years is that staff do what's in policy, especially if they know what they're going to be evaluated on, is that when you reinforce these practices with policy, people are more likely to do it. Would you guys disagree or agree with that? Agree. All right, this is the first time you agreed with me today. Let's see how many more I can get out of you. And next is the quality assurance process. And this is something that's really kind of taken its time to evolve in corrections around quality assurance, right? And when I say quality assurance, I mean ensuring that the stuff that we're using, the programs, the practices, the strategies are being done in a method that's keeping the fidelity of how it's originally intended, so that if someone's using a curriculum for thinking for a change, they're actually using the curriculum and all the different modules and implementing it effectively and with fidelity. So there's quality assurance process in place that makes sure, whoops, not sure what I just did. Oh, there we go. To make sure that the things that we're doing, these evidence-based practices, we're actually doing them with fidelity, right? So what we're seeing across the country is more and more agencies, criminal justice agencies, building quality assurance processes into policy and procedure and doing case file audits and stuff like that to make sure that their staff is actually implementing the stuff in the right way. Because you can have a great Thinking for a Change program, but if you're not, which also shows good outcomes in terms of recidivism reduction, but if you're not facilitating by the curriculum or have the staff trained properly, you're not going to get the same results. Okay? So it's a really important piece. I think that, again, I think it's really starting to evolve across the country. Performance measurement and data collection. We're going to talk about this briefly. I'm going to talk about information sharing shortly. But it's being able to actually demonstrate what you're doing is working, right? Especially, think about the people that do a lot of the frontline work. They're working, they have high caseloads, they're facilitating groups, they're doing new risk assessments, they're, referring them to different services, but they don't know the results of their work, right? So one of the things that's great about performance measurement data collection, you start capturing that information. It doesn't, recidivism reduction or recidivism data, yes, very, very important, but other intermediate outcomes, program completion, treatment completion, less violations, pain supervision fees, pain restitution, keeping track of those different things. Because what happens is, I think sometimes we forget, is that we just we put our nose to the grindstone and we do these programs and do these practices, but we don't know what the end result is. Most of the time, what the end result is, we see the person come back into our office, right? Collecting, data and performance measurement information helps us identify things or programs or practices that work, right? So that's a key piece of information. And then finally, what I've highlighted here is increased information sharing between agencies and partners. So now I'm going to kind of roll into this information sharing piece between agencies and partners. Quickly, though, we know one thing. With all that said, I know that effective entry can be very, very difficult for a lot of reasons. One is that probation and parole officers have high caseloads. We're telling them, you need to do a new risk assessment. You need to facilitate this new group. You need to address these technical violations differently. And they're like, I don't have time. I don't have time to do this. So you also, at the same time, have to manage staff workload in terms of either taking things off their plate or demonstrating to them if you're doing this thing, if you're doing a risk assessment, you're making their job more efficient. And you're also telling me the bigger picture of why what they're doing is having the bigger picture, which is the recidivism reduction. We don't do that enough. But it's difficult because they have high caseloads. We have decreasing budgets and ever-increasing number of people coming into our facilities or to our agencies. We have a lack of services. Our needs, the criminogenic needs, which Debbie will talk about, we don't have the services to match the needs, like substance abuse or cognitive behavioral interventions. We have a lack of staff resources. I mean, I'm sure a lot of you, when I came from Iowa, one of the things is we kept freezing positions, but we kept getting more people in. So lack of staff resources, not enough people to facilitate groups or to manage the high caseloads, so people's caseloads just continue to pile up. And we are in a hiring freeze, so you have a lack of staff resources to accommodate all the things that you need to do to have an effective reentry program. Limited program capacity and availability, just mentioned that. And then treatment versus security, actually getting your staff to buy into the balance of treatment and security, right? Holding them accountable, but also helping with the rehabilitative aspect of it, right? Because I know when I came into corrections, my first 2 years, I was like trail them, nail them, and jail them, right? That's all I did, is I chased them around, I caught them doing something bad. I learned over the years that there's, especially, and also with the research actually supports this too, is that there's a balance. If you do balance between treatment and accountability, you're going to get better results instead of just trying to catch them to do something wrong, okay? So definitely using a balanced approach. And again, quality assurance, you'll hear that over and over again, is developing a system of quality assurance. It's something that cannot be done overnight, has to be buy-in, has to be messaging, has to come from the top down, the bottom up. There's a lot of work to put something like that in place. And then last is the lack of information sharing. And then we'll go into that. So why is information sharing important? So information sharing is contingent upon, excuse me, a couple things. One, this is really basic, the willingness to share information, right? Some people I know like to keep their stuff close, to hold it close to the vest, right? So that's one issue. Like, I'm not going to give my information out to a service provider. What are you going to do with that information? I mean, I can talk about this from a probation officer standpoint. Like, I'm not going to share this with a service provider because who knows? They're not going to understand this, or they're not going to know what to do with this information, or they may somehow use it in a way that might be harmful, right? So it's just the willingness to share information. The second is the ability and capability for partners to share information. So what I mean by that is not everyone's going to have the same shared data platforms. I don't have the IT vocabulary down, so I'm going to try to get through the best I can. But is that people have different capabilities in terms of what they can collect and what they can measure. So sometimes you have different systems that need to share information but don't share the same kind of data platform. And they don't collect the right information or the information that the other agency may need. So there's a lot of issues in terms of what kind of information that could be shared, the quality of the data, things like that. So why is the lack of information sharing? Probably none of these are going to be a big surprise for you all. Guess what? It's not a priority. It's true. A big thing is that we focus a lot on evidence-based practice, which are very important, recidivism reduction, but information sharing is a piece of this in terms of better outcomes, sharing information in a timely way. It should be a priority because we need that information when people are coming back into the community because it becomes a public safety issue too. And it's also going to aid people in making quick decisions. But it's not a priority. Would you guys agree or disagree with that? Agree? That's twice. I like you guys. Can I come back? And of course, capacity. Not having these systems that share information. Like electronic health records is the example I use. Doesn't work with the criminal justice system. Lack of understanding of what types of information can be shared. HIPAA, right? People are like, first thing is what are some of the legal reasons why you can't share information, right? So people, HIPAA is it's a lot of information. It takes a while to understand what HIPAA is. But people like to err on the side of caution, not share anything, right? So we have to also be very cognizant of the types of information that can be shared. And that's a training thing, right? Oops. And then identifying key information to be shared. What is some of the key information that should be shared across treatment providers? Or even get this, between institutions and prisons and community-based corrections, or community-based corrections in prison, there's an issue there in terms of information sharing. You see it all across the country. You think that that would be easy, but it's not. It doesn't happen. as everyone thinks it does, or between jail and community-based corrections, or vice versa. Lack of MOUs or info sharing agreements. People don't know they can enter in MOUs around sharing agreements, so what types of information they can share. Those are ways, too, that can help with the trust issue, too. Again, distrust. Relationships get fragmented over the years. There's lack of trust between maybe the same, for example, maybe a probation agency and a treatment provider, where the probation agency may have thought the treatment provider was providing some kind of protection or enabling or whatever it may be, which, I've seen, one time when I was working in corrections, that there's this distrust that happens, is that they don't trust each other in terms of what they'll do with that information. Funding. It takes money to be able to collect information and have people be able to, collect it in a systematic way to read it and report out on it, right? Funding is an issue. And the quality of data. They say garbage in, garbage out, right? So the quality of your data is really going to matter. So what types of information can be shared? And this is not an exhaustive list whatsoever. But these are some information that can be shared. About risk, housing, needs, employment, education, behavioral health based on if there's a release signed, of course, different interventions. These are things, this is just like I said, this is just like tip of the iceberg. But these are like typical things that, people could share. That's important information to share between agencies that are collaborating or managing a case plan together. I just want to highlight this slide here, is that information sharing around major risk factors. As I'm sure Debbie's going to talk about, you're going to talk about the top 8? Okay. So, sharing the big 4, presence of antisocial behavior, antisocial personality pattern, antisocial attitudes, antisocial associates. Should we be sharing that information between partners? Isn't that going to make a difference for a treatment provider? If I'm a probation officer or working in a prison or community-based corrections, and I'm going to send someone to workforce development or a treatment provider, and they have issues of antisocial behavior, will that information be useful in terms of sharing that information with the provider? Because I'm going to tell you, if they have an antisocial personality pattern or antisocial attitudes, how are they going to be at their job? They need to be coached through that stuff. That's great information to be sharing between partners. So, why is information sharing important for reentry? Risk needs to be communicated. It becomes a public safety issue. Needs. Knowing what criminogenic needs are to be treated in order to reduce recidivism. Having information. So sorry, everyone. Needs. Knowing what criminogenic needs are to be treated in order to reduce recidivism. So knowing what factors that are related to making someone more likely to recidivate, knowing what those needs are so they can be targeted. Services need to be coordinated. Okay, reduce the duplication of services. This is kind of a big one. If a prison, for example, in community-based corrections, someone comes out in community-based supervision, and the parole officer gets this person, right? And they're like, I got to do a risk needs assessment. Well, there might have been one just done prior to them leaving the institution, but if they're not sharing that information, that probation officer may have to do a whole entire full screen, right, where they may be able just to do a reassessment based on because they're back into the community. But that's a great example of if that information gets sent to community-based corrections, they're duplicating services or duplicating their efforts. When we know that most probation and parole officers and people working in corrections have very high caseloads, and that's it's a time-saving thing too. You're saving resources. Next is increase the seamless transition. Continuity of care, like I mentioned earlier, is being able to keep parallel services when people go out, right? So treatment records or disciplinary records are able to be transferred out immediately when they get out into supervision. So probation or parole officers or community treatment providers knows what they're dealing with. Or they're, again, not providing duplicate services and starting them out earlier on in a phased treatment approach when they're already on phase 4. So just in terms of continuity of care, we know that offenders are at the greatest risk through the first 6 months when they're out. So getting them connected to services sooner is ideal. And that's what also can result in better outcomes. Decision making. This is a key piece of information too. Lack of timely info exchanges can impact public safety. Risk information, behavioral health, victim information, all this stuff is so important in terms of getting that information to people in a timely manner. So effective reentry management will require, as reiterating a few things I said earlier, is close collaboration between criminal justice agencies and service providers. Okay, it has to be done, especially when we all know that corrections, jails cannot provide all the services. They have to work in partnership. Guidance on a business process for information exchanges is having some guidance of like what are some of the process, like what are some of the more technological things that have to be done in order for this to happen. And then policies to support the information exchanges. Developing, again, policy and procedures around that so people know what to do. And also, again, people are more likely to follow policy and procedure. And then standards for what information should be captured. What are like the top 10 things that should be captured? Getting a treatment provider in the room and getting corrections people in the room and say, what are the information you want to see the fastest and what's going to be the most helpful to you in order to do your job in an efficient way. How am I doing on time? All right. All right, so last, I'm going to go through some case studies and some real innovative examples around information exchanges that have been really helpful and have impacted different agencies across the country. So if I have 10 minutes, and I apologize in advance, this is text heavy, but I think it's really important that you kind of see the different things people are doing across the country as well as the impact it's had. Maybe there should be some whiskey in this or something. It might help a little bit. Not in Utah. Oh, really? Okay. I got to get out of town quick. So in Oak, I forgot this is videotaped. Don't show my boss, please. So in Oakland, they did arrange with CitySpan Technologies, developed a web-based database with information from both Oakland Unified School District and Alameda County Juvenile Probation. And what they did with this system was referrals to community-based partner organizations are sent electronically through the database, and partners then gain access to the data for the youth who have been referred to them. The data sharing allows case managers to receive electronic updates on the youth's probation status, risk assessment scores, and court date changes, daily attendance reports, suspensions, and academic process. So bear with me. So here are the benefits of this. The database and reporting system gives the case manager crucial real-time information about the current needs and circumstances of the youth, which helps them provide the most effective support services. So it's kind of back to that behavioral and social learning principles, is that if something's going wrong, or if there's some kind of behavior that's in violation of their supervision conditions, you get to address it right away, which has a greater impact, right? And also, you can also catch things before they totally go off the rails, right? So this is a great example of that. And then, of course, the timely interventions and increased responsiveness. My next example I want to use is the Oregon Youth Authority. This partnership, local county juvenile departments across the state and other partners are operating a statewide database which compiles data on youth involved with the juvenile justice system in all the state's 36 counties. This database allows OYA and its partners to track the involvement and outcomes of youth in a statewide system, share information on youth across juvenile justice jurisdictional and agency lines. Information includes a wide variety of reports, recidivism, other youth outcomes, and create a unified operational case management record. The benefits: create a better understanding of the youth's needs and risk of reoffending to determine appropriate placement and service decisions. They were able to develop a comprehensive performance management system that measures the effectiveness of key activities throughout the agency, ensuring that decisions regarding youth are based on data and that the services they receive are appropriate, effective, and correctly administered. And they accurately predict, this is kind of the cost-saving piece too, they accurately predict the number of facility beds the state will need over the next 10 years, which will help increase cost savings. Another example is the Vermont Department of Corrections. They developed a database or a dashboard, and it is an innovative template for quarterly reports to summarize key data for corrections agencies, including change in corrections populations, recidivism indicators, and average length of stay. The dashboard is a 2-page quarterly snapshot of correctional and supervision populations, offender characteristics, and their involvement and their movement throughout the system. Specific figures include numbers of admission, population size, number of returns to incarceration, number of individuals sentenced, and the number of individuals under supervision. So the benefits they had is the dashboard system allowed Vermont DOC to easily view a wide variety of statistics, observe trends, and assess progress toward agency and legislative goals. Again, back to what I was saying earlier, is that be able to actually see that what you're doing is working and be able to track that. And assist with planning and allocation of resources based on the population trends. Finally, I want to talk about Indiana Division of Youth. Just so you know, because I'm going through these quickly, I'm guessing that you guys can get a copy of the PowerPoint slides if you want them. Okay. In Indiana, the Division of Youth Services calculated the impact of lengths of stay in their secure facilities on youth recidivation rates when they return to the community. The data show that youth with a low risk of reoffending were confined for longer periods of time were recidivating at a higher rate. And one thing I think Debbie will be talking about is why you don't want to engage low-risk offenders. In response, the agency worked with a course to reduce the time these low-risk youth spent in the facility. So here's the benefits. In a 3-year period that followed these reforms, the percent of youth who were reincarcerated fell from 39% to 30.5%, and then shortened lengths of stay have had a significant fiscal impact, accounting for approximately $12 to $15 million in savings annually. Lowered the overall correctional facilities population, and the state estimates a 3-year cost avoidance of $167 million based on that, because the number of youth returning to these facilities would have been higher, even higher if the state had not reduced its recidivism rate. So some final thoughts for you all. I kind of summarized it down to, I thought, information exchanges can serve really 3 primary purposes. And there's other ones, of course, but these are the main ones. And you've heard me say this already over a few times for this presentation, is reduce inefficiencies, right? Again, protecting scarce resources, avoiding duplicate efforts in terms of maybe risk assessment, programming, all types of different interventions that an offender may have be identified as a need. Improve the quality of services provided upon reentry in the community. Again, that continuity of care. So many times when people come out when they come back into the community, whether it be from jail or from prison, they maybe get a 30-day supply of psychotropic drugs, or they're given, they don't have a next appointment lined up, as I mentioned earlier. It's so common for these services to be fragmented. It's so important knowing that they're the most vulnerable between 6 to 12 months to make sure they have these appointments set ahead of time, they have enough medication, and that there's continuity of care, right? And public safety, having information readily available that may complicate reintegration and service barriers to desistance. And so I lied, I have one more final thought. Gordon mentioned something that kind of really hit home with me when he was talking, is that, there's kind of a culture change thing that's going on, I think, in the criminal justice system, is that I think what we've realized, especially you all, since you guys are, innovative bunch and progressive thinkers, that we can no longer do business the way we used to, right? We have to use evidence-based practices. We have to rely on what the research is telling us. I think of all the people I worked with for, 10 plus years, they said, oh, we always did it this way because that's just the way we did it. Nothing ever happened on my shift. And there's still that thinking. And I call that kind of the crunchy thinking, right? But we have to, when we see these statistics that I put up earlier, we see those statistics with 7 million involved, is that we have to do things differently, right? We have to also embrace it as a culture too, because we have to approach things. We have to listen to the research. We have to be able to think outside the box in terms of our practices, how we supervise people. And so I'm really, really thrilled to be here and honored to be here today, because this is what you all are doing. You guys are thinking outside the box, and you're all coming together, such a diverse group of people. And this is what needs to be happening in terms of culture change across the country. So I'm very honored to be here and really appreciate the work you're doing. And I'll make sure when I go back as the out-of-state expert to New York and let them know all about the great things you guys are doing. But thank you for your time and putting up with my cough. Appreciate it.